activating the one specific point, that point to be known as a tapav, that is spleen 21. So from spleen 21 terminated the energy, then the next energy started, that energy to be known as a Shao energy, that means is the Shao in energy, that is the heart energy started from the axilla region. Spleen 21 terminated, again the energy started from here and connecting to the Chi Chuan. Much before that, there are the three branches are there. One branch to be known as the energy starts from the heart itself, then it descends to the downwards direction to connecting to the small intestine. The another branch starts from here, then goes to the esophagus and then throat. From the throat, it terminating the energy on the inside of the inner canthus of the eye. The third energy starts from the chest region. From the chest region, it goes to the axilla region. From the axilla, it interconnects. Then the tapav point, spleen 21, ascends to the upward direction and then interconnect together to form the one particular point. That point to be known as a Chi Chuan. That is point to be known as a Chi Chuan, that is the H1 point. H1 point is located inside the axilla, but however 1.5 shown. So when you wanted to use this point, but you place the fingers, hand on the posterior side of the back of the head region, then you can find. In this way you need to place it and then try to find out the point is located at the center of the axilla region. But however, I just apply this needle towards the GB21. Towards the GB21, I just applied towards the GB21. This point is the great point to treat for the shoulder adhesive capsulitis or the shoulder brachial syndrome, where the abduction of the hand is not taken place. That particular time you just apply. If the patient is comfortable, are you comfortable really? So then if I by mistake I inserted the needle on the artery or on the vein or on the nerve of the axillary level, then the patient feel I have the vibration, I have some kind of the pathetic sound, or internally feel kind of the some kind of the vasovagal tone shock. That time we have touched to some kind of the nerve. Then you just pull the needle again, then again insert on the beside of that artery. That would be better. But hopefully you understand. In this way we just apply, but this not more than 1.5 chun. 50 mm needle is not advisable, maximum 40 mm needle, but insertion is only the 25 mm needle should insert it to the deeper level. That would be better. So make sure sometimes patient doesn't feel. When are you feeling? On the cloth we inserted the needle, so in needle is inside, but the patient doesn't feel anything, but they should feel that internally pierced inside the muscular system. But this muscles is the teres minor and the pectoralis minor muscles. So between this point is located, but you just activate this point is beginning point of the heart system. When this area is hygienic, so female to female or the male to male, that time we wanted to recognize that the pulsation, place the finger on that particular region, you palpate on the two fingers, then the pulsation is good. Then you remember the axillary artery is good. When the axillary artery is good, then the brachial artery is good. Where the hypertension, we used to see the blood pressure monitor, we place the stethoscope on the brachial artery. So therefore the brachial artery is good, then the hand artery is also good. The digital arteries are good, flexor arteries are good, dorsalis arteries also good, interiors muscles also good, flexor muscles also good, lumbrical muscles also good. When we understand there is no numbness and there is no coldness in the hand, that indicating your heart is good, is pumping to the entire system of the body. But the upper limbs and then lower limbs all are controlled and regulated by the cardiac system as well. When there is no coldness and then chillness, then you remember the person having the good quality of the heart is pumping, the blood is precisely good. So therefore this point is the beginning point. The second point to be known as a Chingling. The second point to be known as a Chingling. So You just use this point where exactly from the heart 3, from heart 3, 3 chun proximal. 3 chun proximal, where exactly from here to here there is a connectivity. This point to be known as a H2, there is a Chingling. So anything, even this condition, shoulder related conditions, we can use this point, but you make sure in this same direction only we should apply. Place the hand like this. When the abduction to be taken place of the elbow, then this is the 90 degree, this is the 90 degree, then hand goes on the back side. In this way we just apply the needle. That would be better to treat for anything is the biceps muscles, or this will indirectly helpful to the radial and ulnar nerve. You remember the ulnar nerve radiation taken place from the thoracic region. There is the C8 and then T1 region. C8 and then T1. This is the very, very important key factor, remember. So whenever you wanted to treat for the heart channel is affected, then you remember to activate on the neck region. On the neck region, cervical 7, cervical 8, and then the thoracic 1 region is the very, very important on the neck region to regulate the cardiac system and also to regulate this ulnaris artery as well. Ulnar nerve or the radial nerve, the medial nerve, musculocutaneous nerve, phrenic nerve. So these all the 5 nerves are descending to the terminal of the fingers. So therefore, but we are focusing for the 2 nerves as of now. One nerve to be known as a radial nerve, the second nerve to be known as a ulnar nerve. But much before that, there is the auxiliary artery is descending to the downwards direction, then which is connecting to the brachial artery as well. So therefore, these are the arteries are get interrupted. So that time we can use this point. On the golfer's elbow, patient feel, I do have the pain on the tennis elbow. Tennis elbow is on this side, on the other side, but this side, golfer's elbow having the pain. So that time this muscles get affected. Biceps muscle get the contraction. The bicep muscle get the more stiffness. So that time it gets the golfer's elbow. What is required? That muscles get dilated. The muscles get relaxations. When the motor point, we just activate on the biceps muscles. When the bicep muscles open, then the golfer's epicondylitis, the medial epicondylitis, inflammation of that epicondyle, that also slowly get regulated once we will give the rest. But 2 conditions you remember, this point is the cardiac related problem, shoulder related, and then the epicondylitis related problem as well. Patient feel, I have the pain on this region. This is the medial epicondyle, but I have the pain in this region. Patient is complaining, that indicating that is the golfer's elbow. Right? And also patient feel the pain on the ventral side of the forearm as well. When the tennis elbow pain feel on the dorsum side of the hand till the wrist region, but this region the patient feel on the inside of the arm. So that's the reason we just activate this point, will be good point to treat for the golfer's elbow and also for the shoulder brachial syndrome as well. Now I'm talking about the beautiful point, that point to be known as a Shai. So where this point is located? So I told you 3 locations, but 3 locations, marker coding. 3 locations I'll mark it, but all the locations are more or less is perfectly same. So let me see where this point is located. Now the first location to be known as a, I think better we take off this needle. Now we try to find out the location. Where is the chusa? Chusa means is the pericardium 3. Pericardium 3, this is the cubital tendon. From the medial side of the tendon, this is the pericardium 3, and then the medial epicondyle of the humerus. Midway between these 2, this point is located. That point to be known as a H3 Shai. This point to be known as a Shai is the one location. The second location to be known as a midway between the medial means inside epicondyle of the medial epicondyle of the humerus, and then this is the medial epicondyle of the humerus, the medial end of the cubital crease. Midway between these 2, this point is located. Then the third location Third location in the depression anterior to the medial epicondyle of the humerus. This is the medial epicondyle of the humerus. This is the anterior to the medial epicondyle of the humerus. If the patient feels the pain on this region, that indicating some kind of the cardiac pathology, partially it is existing, then don't take it seriously to your mind that you have the cardiac problem. But however, partially, maybe we can activate this point as the free of cost, but you need not to pay me any money. Yes. So you need not to pay any money over here, but however at the cost of free I'll treat you right now, but you will be benefited out of it. So the H3 point, you just activate this point. I think please come Radhamma, from this side you come, then later you also come. Apply the H3 point, would be good point to treat for the cardiac related disorder. This is the grandmother point of the heart meridian, because this is a strengthening to the two organs, one organ to be known as a heart, the other organ to be known as a renal system, right? H3 is equivalent to the K2. So all in the Zoom, I suggest you, I am audible in the Zoom by the way, right?
Yes, sir.
All of you, please you just take your sleeves, fold it your sleeves, and then please you just have the proper location, because day-to-day clinical practice which is required, you just apply this point where exactly is located. So this is the olecranon process of ulna. This is the olecranon process of ulna. Medial side you touch, you can find the bone. So that bone inside that point is located. This point can be useful. You can use H3 or the K2, both the points. This for the hypertension and edema, pedal edema is there, or the hand pain or numbness, or the golfer's elbow, or the shoulder brachial syndrome, or numbness in the hand, or the cold limbs in the hand. And also this is in fact is the grandmother point. It's regulating and pushing the blood to the cardiac system precisely. Whenever the pumping of the blood is not good, then we wanted to activate that. So then certainly being a grandmother point, this will strengthen to the cardiac system. It reduces the kidney energy. It is strengthening to the cardiac system. Therefore, what are the physiology? I told you that all the physiological aspect to be taken care by activating the single point. That point to be known as a Shai. Shai is which direction we should apply? Towards the LI11. Which direction? You just apply towards the LI11. 1.5 tune deep needle you can insert. So in that way you can activate. Then you semi-flex. You semi-flex this hand. If the patient feels the pain, then we take out from the slightly upward direction. Now the patient is comfortable. Then you inserted the 1.5 tune needle deep. Then the patient is asking, is opening the hand. Then inside of the muscles. So pronator teres muscles, this point is located. So these muscles get stuck in between, that needle will going to stuck on that muscles, then that causes the pain. So that's the reason you just pull the needle slightly. Now you just ask her to open the hand, that easily can open without much pain. Right? So therefore further you wanted to insert the needle, then it can be possible to insert the needle. Unless we feel the Dutchy sensation, we can insert to the deeper level, also advisable. Now come to the another point, that is H4 point, is the Lingth of, is the amazing and beautiful points are coming here. Where this point is located, 1.5 tune proximal to the vocal surface, VOCL, or the ventral surface of the wrist crease, and then the radial side. This is the radial side, means it's not on the radial side, this side no, radial side of the tendon of the flexor carpi ulnaris tendon. So therefore this point is located 1.5 chun proximal to this. This point is located. Touch and feel. All of you touch and feel the tendon. Then inside of the tendon, that point is located. I am touching the tendon. Now inside of the tendon, I am just inserting the needle. So this point to be known as a Lingth, that is H4, is equivalent to the U-chi, LU10. This is the grandson point, sedative point, metal point, dryness point, air point. So therefore this point is depletion point, decreases the energy of the heart meridian and then passing the energy or the controlling energy to the pulmonary system, that is the lungs. So lungs pathology is there, or the shortness of breath, breathlessness, or cough and congestion is there. That time certainly we can use this point for the cardiac related problem and then the lungs related problem. Especially the people who are suffering for the hypertension, that also can be monitored and to be regulated by activating this point. But however, this point is good point when the palpitation is there, or insomnia is there, or the excessive function of the cardiac system. So that time we deplete the energy of this and then that you are strengthening indirectly to the pulmonary system. That means influencing to the two organs, one organ to be known as the heart, the other organ to be known as the lungs. So both the pathologies there in the body to be regulated by activating this point. Now come to the next point to be known as a H5 is the Chingling. Chingling is the amazing beautiful point. You can use it this point, but you just inserting the 1 chun proximal to the 1 chun proximal from the wrist crease, then the radial side of the tendon of the flexor carpi ulnaris tendon. So you just activate this point to the deeper level. This point to be known as a in C, that is the C cleft point. Not this is the Chingling. This is not the C cleft point. This is the Chingling, is the luvo connecting point, nexary point, passage point, door point, interior and exterior relationship point, husband and wife meeting point, and then lungs, that means small intestine, and then heart is connecting each other. But therefore this luvo connecting point, the meridian energy goes in this way. The energy goes to the axillary crease. From the axillary it goes to the chest region. From the chest it goes to the cheek, the neck region. From the neck it goes to the cheek region. From the cheek it connecting to the inner canthus of the eye. So therefore this point is good point to treat for the all the tongue related problem, eye related and throat related conditions can be treatable. That means is the oral cavity, glossitis, pharyngitis, laryngitis, or something connected to the stomatitis, or anything connected to the buccal cavity. Certainly we can use this point to treat for the oral related disorders and also eye related disorders. So therefore Chingling is the great point to connect to the small intestine as well. When the preliminary level you wanted to treat for the cardiac problem, then you remember it is advisable to use in the beginning stage. I do have the chest pain, then that indicating perhaps small intestine having the problem, or the digestion related issues, or the metabolism is not good. That time you just interrelated by using this one point, that point to be known as a Chingling. That point is H5, is a great point to connect each other and also treat for the numerous cardiac related disorders. And by the way, this particular point is useful to treat for the hip pain, especially the hip distal point to be known as a. This H5 is good point to treat for the lateral side. On the other side of the hip pain, I just apply the needle on the left hand, but the right side hip pain can be innominated pain, or the gluteus muscles pain can be treatable by activating this particular point, since it is the distal point for the hip region as well. Now coming to the next point, that point to be known as the in C, that means cleft point of the heart meridian, that is H6 point. Where the H6 point? So apply the H6 point, half chun lateral, half chun proximal to the wrist crease, half chun proximal to the wrist crease, exactly. Yes, good. So that means perpendicularly you just apply this oblique insertion, but however you can do oblique as well, but better is you just apply the perpendicular insertion. That would be good to treat for the C cleft point is useful to treat for the emergency control of the cardiac related disorders. Right? Emergency, there are the two conditions you remember. Whenever there is a heart pain, emergency says, yes, I have the chest pain or thorax pain. So that time the pectoralis major muscles pain. Insert this needle. The second point to be known as the second condition to be known as blood related disorders of that particular meridian. Of course, the blood vessels are controlled by the which organ? Of course, is the heart. So therefore, heart related problem can be treatable by activating this particular point, that is H6 is advisable to regulate the blood to the inside the coronary arteries. So therefore emergency condition we wanted to use, but specifically H6 for the two conditions you keep it again, but this point is good point to treat for the myocardium muscles, the heart related muscles called as a myocardium. When the myocardium infection or the heart attack or MI, so that condition to control emergency of the muscles shouldn't get rupture or the muscles shouldn't get insufficient of the blood flow. So that time to activate this point, that will be indirectly helpful to treat for what condition? Myocardium related problem. So therefore it increases and enhances the quality of the blood to the heart system would be better by activating this point. But however, so Jayashri is getting the free of cost is the activation of her cardiac muscles, and also blood flow is good in your cardiac system. So now we understand about the another condition, certainly you keep it in the mind. The another condition to be known as a diaphoresis or the perspiration or the excessive sweating. Especially the women get sweating or the male get sweating or the night time sweats happen. So that time there are this one particular point. The next point to be known as a hook C. The next point to be known as a SI3. Then the fourth point to be known as a folio H7. These are the three combinations are good combination to treat for any kind of the perspiration related to the lungs problem, related to the heart problem. Both can be regulated by activating this point. Right? So hopefully we understand about the H6. Then the next important point to be known as a H7, that's called as a door of the heaven, Shenmen. Right? Shenmen, the point is, where is it located precisely? Come Imran, this side you just apply H7. So H7, come on the other side. So where is the pisiform bone? Now you understand about the 8 bones are existing. This is the scapoid bone, this is the lunate bone, and this is the pisiform bone. This tricotral bone here, then the pisiform bone is here. But the pisiform bone, deeper level, you find that superior level is P7 point. Deep level is the pisiform bone, right? You just insert the needle. Again, you go for the deeper level, you will get the artery. Which artery? Ulnar artery, you will get to the deeper level. This is the entire region, the superficial, the arteries, flexor arteries are there. Then inside the deeper level, ulnar artery is there. So one, you should puncture to the deeper level, but however you can use the maximum is 1 chun depth can be applicable, but for her, but the macinated body is there, for them it is half chun is advisable. So better, where is the H7 point? There are the 2 creases are there. Remember, there are the 2 creases are there. You will get confusion. There are the 3 creases also is there on the wrist region. You can have a look. There are the crease is there, 3 creases, but exactly on the middle crease or the first crease. The first crease, where exactly the H7 point is located. Now you just apply exactly on the crease, the first crease. Yes, here. The tendon is there, tendons medial side, tendons inside on the line of the crease. 2 lines are there, but towards the wrist, very closer to the wrist is there, that point to be known as a H7 Shenmen. Insert the needle. Yes, this the Shenmen is the great point. This, as I told you, heavenly door point. You wanted to see God in the night time. If you will get the sound sleep in the night time, God has filled with the essence. God has filled with the good energy. That energy is the sleeping energy. So that is called as a Wei energy. That's called as a cold energy. Heat energy is active. The Wei energy is the cold energy. That means is the cold, the heart in excess in the night time, but yang is the heart, yang is excess in the daytime, but in is excess in the night time, that you will get the sound sleep. But this particular point is the sun point, sedative point, depletion point, and then it decreases the energy of that particular organ. But this point is equivalent to the which point? Dhatu. That is a spleen 2 point. Spleen 2 and then head 7 both are same function. Then you just activate this point. This indirectly strengthening to your abdominal system, because we sleep in the late night and also we eat in the late night, then sleeping also disturbances. Due to that reason, metabolism is not good. So that time he will get the dreams and also sleep pattern. It goes higher level. That means maybe you are sleeping at 1 o'clock or 2 o'clock. This we are working for the Norway or we are working for the America. Like that we are functioning in India. Being Indians, we are our duty to close as early as possible, then go for the bed. But we work against the nature, but again nature will causes the problem. Inducing the sleep, it causes the problems. So therefore the people know, sir, I take the alprazolam, no, I take the zolpidem, no, I'll take some kind of the hypnotic and sedative tranquilizers that make me sleep. But remember, that is the artificial sleep, but you don't get the natural sleep. If the natural sleep is required, that is the gift of the God, then the person who sleeps very well in the naturally, he get the sleep. The hyper sleep also causes the problem. Hypo sleep also causes the problem. So therefore, what is required for us? What is required for us? So natural sleep is required, but the natural sleep can be taken place by activating the point to be known as a Shenmen, that is H7, that regulates both the conditions for the metabolism of the abdomen and also to get the natural sleep. By the way, this is the conductive system, hyperconduction and hypoconduction. So therefore the heart impulses, that means how the electrical current is passing in the cardiac system, that current to be passed precisely normally. There is low conduction or the high conduction, but this conduction to be making as an equilibrium by activating the Shenmen point. That's the reason right side and left side both you wanted to use. You can use bilaterally, would be better, or you wanted to use as the left side, left hand also advisable. Hopefully we have understand about the H8. Now the next point to be known as a H8. H7 is completed, now is the H8. Where the H8 point is located? Let me see, there are the two important locations I'll tell you. That is a secret. You keep it in the mind. So please pass me the half tune needles. Oh, that's great. Now try to see, there are the two creases are there. So location also I'll try to tell you without touching also how you can recognize. By keeping the anatomical landmarks you will going to learn that, right? H8 is the Shafu. So that is a great point, that point to be known as a Ho-Ra-Ri point or the in-house point, self-governing point. That is the heart tonification point. That means fire point. Without disturbance of any other organs in the body, that one particular point is treating to that particular organ only, right? In that way we wanted to do it. So this, let me see the location. You fold it, you clench your fingers and touch to the palm. Once you touch to the palm, where the fifth digit it touches, the fifth finger digit touches, that point is normally known as a H8. So where you are touching? Yes, no, you touch, aram se, you touch it, yes. No, touch it, yes. Now she is touching to here. That means there are the two creases of the palm. One is the distal crease or the main palmar crease. The second crease to be known as a proximal crease. These two creases, the superior crease, not on the finger place. The superior crease to be known as a H8. The superior crease to be known as a H8. I'll just mark it where this point is located. This point to be known as a H8 is this point. H8 is, this point is the H8. This point is H8. So therefore the H8 point is superior to the, H8 is the superior to the crease. This point is located. Then the next location to be known as a comproximal level. Comproximal level where the carpal bones starts. The fifth carpal bone where it starts, that junction of the fourth and fifth carpal bone, that bone to be known as this point. This point to be known as a H8. Both the points are belongs to the H8 point. Both the points are belongs to the H8. Minor H8, major H8 point. But the entire region, for example, now I wanted to tell you, this is the entire line to be known as a cardiac line. The entire line to be known as a cardiac line. How this line to be known as a, the points are located here. The points are located. The 4 points are located on the wrist crease. 4 points are located on the wrist crease. Then this line also to be known as a heart line. So whenever patient feels some kind of the discomfort on the cardiac region, we ask them to press this region every day, morning or night. The heart blockage is there, cardiac blockage is there, stenosis is there, or the myocardial infarction in the acute level, it is emergency condition. We need to take the hospitalization. But other related problem, 50% blockages, 60% blockages is the coronary artery, single artery vessel problem, or the dual artery having the problem, but still the collaterals are taking care. In that condition, we can add up this point to treat for the giving the acupressure point in this particular region. This will be really good point to treat for the cardiac related disorders. But this point also feel the tenderness, some kind of the pain the patient feel by giving the pressure, that also indicating there is a cardiac energy is insufficient. So therefore we just activate that point is always is good to treat for the cardiac related. Now this point is treating for the left side I am using, that means the mitral valve to be activated on the right side of the H8 point. This point is treatable for the tricuspid valve, this treatment for the bicuspid valve. That means atrioventricular valve. There is a right atrioventricular valve is opening, closing to be taken place by activating this point. The deoxygenated blood is taken care by this place, and the oxygenated blood is taken care of by activating this particular point. So therefore both the sides is advisable. When you are inserting the needle bilateral, you can use it. But by the way, this point is slightly painful point, but I just apply this point. So where exactly this point location? I just use this point is the P8 point. P8 tonification and sedation, that also applicable. Once I just apply, so now it is the tonification. One same needle I wanted to this as a tonification towards the energy flow. Then I wanted to use the same needle as a sedation, that is anti-direction of the energy flow, as a sedation also to be taken place. In this way, we just whenever require the heart energy more, you just towards the energy flow, you just apply. When the heart is functioning more, already excessive blood supply is there, you wanted to sedate the heat energy, that time we can use it, because this point also to the heat point. At the same time, the patient is feeling that, sir, I do have the temperature for the last 15 days, I have the temperature, and due to that reason I cannot do work, and my lassitude is there, and I cannot focus and concentration cannot be taken place. I have the lethargy and fatigueness. So that time you wanted to use this point as a bleed this point, or you can insert the needle and then leave it for some period of time as a sedation. The temperature also will come down normally by using this particular point. Then the palm sweating is there, or the palm pain is there, or the contraction is there, or we call as the carpal tunnel syndrome, which causing the pain on this region. This also supportive point for that particular condition. When the paralysis patient cannot fist close and then open, because this point is located on the lumbrical muscles, there is a superficial muscles, the deeper muscles to be known as the lumbricals. So lumbrical muscles are attaching to the fingers. The palm muscles are called as a lumbrical muscles. So those lumbrical muscles having the some problem, stiffness, or the patient due to some reason he cannot write, Parkinsonism disease or the PD problem, so that time also we can use to regulate the energy flow. Even last night I have seen the PD patient, first patient, where the substantia nigra is affected. I activated this particular point to strengthen the overall health of the cardiac system. So now let me see the last point, but definitely it is a great point. We can see that point to be known as a H9, that is a Shao Chung. Now there are the two locations I will tell you about the H9. So let me see where these points are located. So now you just see the points are located here. Point 1 chun proximal to the, please give me half chun. Point 1 chun proximal to the, point 1 chun proximal to the nail matrix. Point 1 chun proximal to the radial side of the corner of the nail base of the pinky finger. But this point is mother point. Just I am using this point as a tonification. This point as a tonification. This point as a tonification I have done, stimulated the energy in being a grand, this is the mother point. So H9 is equivalent to the liver 2. So liver 2 you can use it, it takes energy from the liver, it strengthens the energy, because liver is the mother for the cardiac system. Therefore this point is really great point to treat for this left side. I just applied this needle, the left side is taking care for the aorta. On the left side, when I applied on the left side, this is the pulmonary artery to be taken place. So this is the pulmonary valve and this is the aortic valve. There are the two places I just applied, right side and left side. Sir, one place we can put one needle is quite enough. But however, according to the modern acupuncture, according to the clinical acupuncture, we wanted to use for the cardiac related problem. Heart is located bilaterally. Meridians are located symmetrically. The heart is biologically located. Where is it located? 1/4 is right side, 3/4 is on the left side. But from where to where it is located? From the second intercostal space to the fifth intercostal space, the heart is located. So therefore, for all the conditions, certainly for the walls are good. The tricuspid and bicuspid walls are good. The aorta and then pulmonary walls are good. Then the circulation also good. In that way, this point to be known as a Shao Chung, that means is the rushing of the blood to the heart. So according to the evidence-based applications, it says that angina pain can be treatable within short period. If the patient is coming for the heart pain, I do have the chest pain, so that time we can use it this point. But if the patient feels uncomfortable but still having the pain, then directly recommend them to go to the hospital, try to find out the ECG and then echo and TMT and angiography. If at all required all these parameters and also the blood pathology, what it is executing, based on that we'll take the analysis. If all the parameters are more or less the same, then it is not related to the cardiac problem, it is related to the pectoralis major, pectoralis minor muscles having the pain, so related to due to some kind of the exertion of the work, or something we have overstrained, we used or lifted anything which causing the pain on the pectoralis chest muscles. That time also we wanted to use this local point. You can use the local point, and also you wanted to use as a distal point, also good. But by the way, this point is great point to treat for all the unknown cardiac pathology related disorders. However, everybody in the outside, you can have a look. The millions of the people are existing, living in this planet, but all the people having one kind of the biological heart. But all of us, how many heart we do have? Two heart is there. One heart to be known as a biological heart, but the second heart to be known as a kind heart. But keep the kind heart always within us. That will be fruitful for this life and also eternal life and heavenly life. But heavenly life you wanted to see blissful and happy, then this life and then both the life can be successful if you have both the hearts. But biological heart is where is existing. Here the biological heart is here, but kind heart is here. It connected each other, soft copy and hard copy will be very fruitful. Thank you.